There is a simple process that anyone can use in an emergency called the 3 steps to save a life. This quick approach is at the heart of the Resuscitation Council guidelines and shows that even without medical training, anyone can take life-saving action. Step 1. Check. Before anything else, check for safety. Make sure the area around you and the casualty is safe. Look for traffic, electricity or other hazards. Once it's safe, check responsiveness. Gently tap their shoulders and ask loudly, "Are you okay?" If there are no responses and the person appears unresponsive, move on to step 2. Step 2, call. Call for help without delay. Dial 999 or 112 in Europe. Put your phone on speakerphone so you can keep your hands free. While you're on the call, the emergency dispatcher will guide you through what to do. They will help you check for normal breathing, look, listen and feel for no more than 10 seconds. If the person is not breathing normally or is only gasping, tell the dispatcher immediately. Follow their instructions closely. They will talk you through the step-by-step process of resuscitation. Finally, step 3, CPR and AED. If breathing is absent or abnormal, start CPR straight away. Place the heel of your hand in the center of the chest, put the other hand on top and begin chest compressions at a rate of 100 to 120 per minute, pressing down around about 5 to 6 centimeters each time. Allow the chest to rise fully between compressions. If an AED is available, turn it on immediately and follow the voice prompts. The device will tell you when to stop compressions, when to stand clear, and when to resume. If you're unsure at any point, don't panic. The dispatcher will stay on the line and talk you through exactly what to do until help arrives. So remember the 3 steps to save a life. Check, call, and start CPR. And if one's available, use an AED. These simple actions, performed quickly, can double or even triple someone's chance of survival. You don't need to be a doctor, just confident enough to act. Your hands, your phone, and your courage can save a life.